Hello.
My name is Emily Sims. I'm one of the Peds Endo faculty, and I have been tasked with talking to you guys today about research opportunities available for Pediatric Endocrine Fellowship at Wiley. I also wanted to say before I start this presentation that I actually did my clinical residency and fellowship training at Indiana University, and since then I've stayed on as faculty. So I'm also available to answer any questions about the fellowship if you guys have any and you didn't get a chance to meet with me today or during your fellowship interview day. And I think that I've included my email at the end of this presentation, so feel free to ask any questions.
Okay, so I think
I would start this presentation with a good description of who I am, what I do, and why I'm qualified to give this talk. So this is a picture of me with the blue arrow in my lab. So my name's Emily Sims, and I'm actually a physician scientist, and I have a research program focused on diabetes. And my lab is really a basic and translational research program. So we run the gamut from studies on cells in a petri dish, mice that have had their genes mutated that we're studying in vivo, as well as human samples from islets from donors who had diabetes and controls, or human blood samples from kids with new onset diabetes, to metabolic studies in people and intervention studies in people that I participate in through TrialNet. So here's a picture of me at a microscope, just as evidence that I do basic science work. This is a mouse, and this is a human islet, actually, that's been stained for insulin and glucagon. These are some clinical pictures from clinical study participants who participate in TrialNet studies. And in my lab, I have a clinical coordinator, PhD trainees, PhD postdoctoral trainees, MD clinical fellow trainees, and then a technician.
so most of my
My time is currently focused on research, but I do still do some endocrine, peds endo, and diabetes clinic, mostly type 1 diabetes. And I think an important point here is that I never thought I would do research. So I was kind of firmly thinking I would go the clinician educator track at some kind of academic institution because I loved seeing patients. I loved thinking about problems in clinic. And I actually really like teaching trainees as well. So I was thinking academic, but not necessarily research. But in part because of the amazing research experience that I had at IU, I decided that I was going to go for that as my career. And I have continued on in research as faculty. And I think it's led to a really satisfying job that I've been really happy with.
so
So maybe you're sitting there thinking, I'm not really that interested in research. I'm looking at a clinical fellowship. Why should I care about this? Well, I want to argue today that you should be thinking about this as you're looking at fellowships. So, and there are 3 reasons that we're going to talk about. The first being, this is an awesome opportunity that is a perk of training at a big academic institution like IU. Secondly, it's important as physicians that we care about research because it's actually really important for our patients, and ultimately that's what determines what we're going to do for patient care. And then finally, research during fellowship makes you more competitive for jobs. Just pragmatically, that's the truth. So it's something to think about, even if you think that might not be something that you're going to do long term.
so
I wanted to go into these in a little bit more detail. Why is this such an awesome opportunity? Well, specifically IU, there's a really diverse range of different kinds of research to get involved in. We're going to talk about this more later. And you know, this might be your only opportunity in your career to try this out and get a perspective on this stuff. So I would really advise you to take advantage of this opportunity. And finally, IU has this really amazing research infrastructure with lots of resources that are available to really set you up for success, not only with the projects that you're involved in fellowship, but also with research long-term, if that's something that you're interested in.
so the IU
Infrastructure is so great, I had to give it its own slide. First of all, just the way the Peds Endo Fellowship is designed is really favorable for research. So it's kind of clinically front-loaded. So you still do clinic and some service in the second 2 years, but it's less than the beginning. And that really allows you to focus on successfully implementing your primary research project. If you look around and ask people who do mostly research for their job, the percentage of research versus clinical effort, usually their percentage of research effort is higher just because it's hard to be really, really good at something and not have that be the thing that you're doing most of the time. So this is a good thing because it really gives you a chance to dig in and do a really great job on that project. And because of this, fellows in our program are really productive. So they publish a lot of papers, and they usually present work at national meetings every year. Often it's an oral abstract presentation. So if you haven't been to a national meeting, the way that it works is you submit an abstract, which is like a bird's eye view summary of your project, and then judges score the abstracts, and the best ones get selected for oral presentations. And so you get to present your work to a crowd, which is a great experience. You get to do some networking, and it looks really good on your CV.
So there's also a lot
of resources available to help you improve your research skills at IU. So there are classes that you can take, so like stats, epidemiology, you can take classes in molecular biology. There are a lot of different options there. There's also a program called the Morris Green program that is through the Department of Pediatrics and is really unusual. The idea of this program is to help develop and support physician scientists. So it's a competitive program that you apply to, and the members meet regularly to have a speaker talk to them about different research topics. So, you know, maybe it would be effectively using PubMed, or kind of basic statistics you can use, or putting together a poster. Those kinds of things. They're really practical and actually really helpful. You get to network with other people who are doing research at IU, which is great. They have 2 retreats a year that are focused on different topics that the participants identify. And they also do a grant writing workshop, which is really nice. Or it's like they do a study section. So you write a specific aims page, and then you actually review other people's pages. So you get a lot of experience with the writing and what goes into the reviewing of that. So really nice program. Also, we have a really robust clinical and translational sciences institute, or the CTSI, and there are a lot of opportunities through that. So there are additional mentoring opportunities. They have a lot of career development workshops. So like on mentoring yourself, like mentoring other people, maybe on mediating conflict, different personality types. There are a lot of different workshops they have. Also, they have communicating science and grant writing workshops, which are really good, which I would encourage you to participate in if you come here. Something that's really unusual about IU is that there are a ton of internal funding opportunities. And there's actually even a pediatric fellowship grant that's for $10,000 this past year, which is pretty nice. And there's not kind of a required expectation that you're going to apply for a grant and get funding for your project. And a lot of times people actually are able to kind of jump on a project that their mentor already has funding for, kind of already got started. But it's always nice to have a little extra money to do a little side thing that you think is really interesting. Or if you identify a really interesting question, to be able to test that in a pilot project. So these kinds of funds are really nice for that. And they also look really nice on your resume. So we've had a couple of fellow projects that they've been able to get funded through this pediatrics fellow grant opportunity, which are listed here.
All right, so I'm going to move
on to the second reason that you should care about research, which is that research is really important for our patients. And ultimately, it's what determines what we do for patient care. So I wanted to give 2 examples here. The first is this intranasal glucagon. So for people who take care of diabetes or don't take care of diabetes patients, when patients have hypoglycemia or low blood sugars, normally you can just treat that with carbs. But if they're really out of it and the parents don't feel safe giving them carbs, or if they're having a hypoglycemic seizure, you have to administer glucagon. And traditionally, the way this went was all of our patients got one of these red glucagon kits, because glucagon wasn't stable in suspension. So you had to keep it in the kit as a powder. And so, you know, imagine the situation, a kid's having a hypoglycemic seizure, you know, hopefully this is the first time, this isn't something that happens all the time. And the parents freaking out, and they've got to go find this glucagon kit. And then they've got to reconstitute this powdered glucagon. They have to put that liquid into the powder and shake it up, make sure it's totally dissolved, and then administer the injection. It's even worse if it's someone who isn't used to giving the shots, like, you know, another parent at a sports game or a roommate in college, right? And so you can imagine a lot of times under this really stressful situation, it didn't get administered the right way. And so recently, this intranasal version was developed. And the way that you administer this is just like allergy meds, where you just click and do a puff into your nose. And so it's a lot easier. And we were actually involved in studies testing this drug in children to make sure it brought up their blood sugars under a controlled hypoglycemia setting, similarly to the traditional glucagon kit. And it did. And over the past year, we've started prescribing this to patients. And I would say, I mean, like 80% of my patients are on this now. And, you know, hopefully they'll never have to use it, but I think the families feel a lot more comfortable sending their kids out with this as their emergency glucagon, knowing that their kids are going to get the treatment they need. And so that's been really nice for their quality of life. A second example that I wanted to give you guys is this study that was published in the New England Journal of Medicine in 2019. And it was performed as part of the Type 1 Diabetes TrialNet group. So TrialNet, for those of you who don't know, is this international consortium of clinical centers, and IU is one of the clinical TrialNet centers that was designed to identify people at really high risk for type 1 diabetes and enroll them into type 1 diabetes prevention studies to ultimately prevent type 1 diabetes. And this study was this landmark study that showed that you could use this immunomodulatory therapy, teplizumab, and it targets T cells, and you could administer a 14-day course to people at really high risk for type 1, and it delays their diabetes by 2 years compared to placebo. This is just one-time treatment. So this was a really big deal, and this drug has actually received breakthrough designation for the FDA, so they're trying to get it approved for prevention of type 1 diabetes in patients. So I envision, you know, in the years down the road that we'll start to see immunomodulatory therapies as a potential treatment in our arsenal of treatments for type 1 diabetes or people at risk for type 1 diabetes. And, you know, there will be more studies that involve different combination treatments or maybe repeated dosing of teplizumab to see if we can get this effect to last for longer. But it's been very exciting to participate in this and anticipate and talk to patients about, you know, what this is going to mean for treatment down the road.
All right, so
I also just wanted to emphasize, you know, as physicians, we are in a really unique position to contribute to research because we really understand how these problems impact our patients and how these treatments could potentially impact our patients. So, you know, a scientist who studies biology also is super important, but this is something that, you know, is really unique as a physician that you bring to the table in science. And so, you know, maybe you could be involved in something that is going to truly translate to impacts on patient care. And walking both sides of this line can be super rewarding and lead to a lot of job satisfaction. I put this image in here because one of my friends in the diabetes center actually always says this when we're at TrialNet meetings, because if you're a Hamilton fan, Aaron Burr always wanted to be in the room where it happens. And that's what it feels like. You know, you're actually participating in research that's going to change what we do with our patients. And it's just very cool and exciting.
all right, so
The third reason that I wanted to make sure I mentioned to you guys, which I know that we all think about, is that research during fellowship actually does make you more competitive for jobs. So, you know, most of our fellows, as I said, are really productive and end up with multiple research presentations at meetings and multiple first author publications by the time they graduate. And this is really great if you're interested in academics, but it's also good if you're interested in private practice because it shows the group that you're a go-getter and you can take a project to completion. Additionally, it might be an opportunity for you to establish a clinical niche if that's something you're interested in. A lot of groups, everybody has their kind of own little thing, you know, so maybe you're interested in transition or bone or cystic fibrosis related diabetes. And a lot of times that comes from a research project or a research interest that you got started during fellowship.
So I wanted to
Spend a little bit of time talking about the opportunities that are available for research at IU. There are a lot of them, and I'm going to start with the Diabetes Center since I do diabetes and the Diabetes Center is great. We actually are an NIH-funded diabetes center at IU, which is a really big honor. There are only 16 of these centers in the United States, and IU is one of them. And that comes with some extra funding. You get a bunch of funding for core facilities to do different services. Like we have a translation core, a mouse core, an islet physiology core. So there's a lot of different opportunities related to that if you're interested in that kind of research. They also have a special seminar series and a big diabetes symposium every year that we get a lot of really good outside speakers to come to. And within the Diabetes Center, we have a core group of basic science investigators in the Medical Science Building. in the Wells Diabetes Group. All of their pictures are here. The entire Diabetes Center is led by Carmela Evans-Molina. So she, me, Amelia Linneman, and Jason Spaeth are all really interested in islet beta cells and the biology of those beta cells as diabetes develops. Jamie Felton is another pediatric endo faculty who studies immunology of type 1 diabetes. Lim Kwa is a neonatologist who studies gestational diabetes, and Hangsha Ren studies neuron regulation of the islet and also gut endocrinology. And beyond this core group, there's also a lot of basic scientists in the bigger CDMD, the Diabetes Center, over 70 scientists who study different kinds of biology. So fat, muscle, liver, kind of anything you can think of that you might be interested in related to metabolic disorders. There's probably somebody studying it that you could work with.
We also have a pretty
active clinical type 1 diabetes research program that's headed by Linda DiMeglio. She has a big research team and a couple of other peds endos who work with her a lot, including Anna Neiman and Hiba Ismail. And they do a lot of work looking at clinical and translational studies in people at different stages of type 1 diabetes before, during, and after onset. Linda directs the Type 1 Diabetes TrialNet Center, and they do a lot of, they participate in a lot of trials looking at different kinds of diabetes technology, so sensors and pumps, as well as new insulins that maybe work faster or last for a really long time. Anna is really interested in quality improvement outcomes in diabetes. And then Hiba has a special interest in type 1 and the microbiome. She actually has an interventional clinical study going on right now in new onset pediatric patients where they're looking at effects of administering fiber on microbiome and beta cell function. And she's working with one of our fellows on that.
So we also have a pretty
active type 2 diabetes research program. Tammy Hannon is our faculty who's most active in that area. And she does a lot of type 2 diabetes care implementation and outcome studies, which have been really interesting. Anna Neiman and Zita Nabhan are both also really interested in type 2 diabetes, and they're participating in studies looking at different kinds of type 2 therapies in kids beyond metformin and insulin. Tammy also has some interest in beta cell function in type 2 diabetes, which we know the dysfunctional beta cells are probably the most important thing in type 2 diabetes, in addition to insulin resistance, and also the impact of poor sleep in type 2 diabetes.
So there's also
the active bone research area at IU. Within Peds Endo, we have two faculty who are big experts in bone research. Eric Immel, who's an international expert in X-linked hypophosphatemic rickets. And actually he was involved in this big landmark study that just was published describing a new treatment for this disease, which was really exciting. And then also Linda DiMeglio also has an interest in bone. And earlier in her career did a lot of work with osteogenesis imperfecta, and we still see some of those patients coming in for bisphosphonates on service. They also both have specialized bone clinics that you can participate in and really learn a lot about bone-related disorders. Is another faculty member in our group who has been really actively involved in mentoring trainees in their primary research projects. And so she's an expert in a lot of areas of pediatric endocrinology, and she's actually, at the time I'm recording this, last year, she was the president of the Pediatric Endocrine Society. But probably I'd say the thing that she's the best known for is in the area of puberty and sexual development. So she's done a lot of studies looking at treatment of different kinds of precocious puberty. She's really well known for her expertise in McCune-Albright syndrome and has been involved in treatment studies for the peripheral precocious puberty that occurs in McCune-Albright syndrome. She also is a big expert on disorders of sexual differentiation and gender identity disorders. And actually, one of our fellows who just graduated, her primary project was related to treatment in gender identity disorders, and she worked on this with Erica.
So in addition to
these people who do research as their primary job, we have lots of faculty who are really great educators, really fun to work with, who are really great about kind of grabbing you or identifying an interesting clinical question on service and working on a little research project with you. And so this is the way that a lot of people that graduate from our fellowship are able to be so productive and generate a lot of these manuscripts. So great faculty, lots of opportunities to be involved in reviews or case series or small clinical projects. And I also wanted to highlight Emily Walvard and Zena Nabhan, who are both really active in their jobs in medical education, in administrative roles, both with med students and with residents. So if that's something you're interested in, I think potentially there could be an opportunity for research or academic work related to that.
All right, so
To summarize what we talked about today, I'd really consider opportunities to get involved in academic research and fellowship wherever you go. But the opportunities at IU are great for research. And I think they're really a big strength of this program. So you should think about it. And if you have any questions, you can feel free to email me. I'm always happy to talk to people who are thinking about our program. And my email is listed here. It's eksims@iu.edu. And again, my name is Emily Sims. And I hope you guys have a great day and a great interview day. All right, thank you.